Well, back pain is becoming quite a pain for many children, believe it or not. A new study finds that 1 in 3 young people between the ages of 10 and 18 have reported having backaches for the past year. Joining us now is Dr. Jennifer Caudle from Rowan University. I can't imagine
10 years
what
old.
in the
Yeah,
world.
it's kind of surprising, right?
Yeah.
Because we think about back pain. We think about older folks. We think about adults. We don't think about
I
kids.
wonder if sports are too intense
Well,
these days.
you know what? You might be onto
Yeah.
something there, because it was a few thousand kids that were surveyed. It was roughly 1 in 3, and the researchers are thinking that maybe there's a few things involved. Back pain was highest among those who were involved in sports. So perhaps sports or certain physical activity certainly may play a role. Obesity may also play a role, and that kind of makes sense too, right? But then there's also, I think, mechanical things that we must think about with kids, like, you know, the idea of the backpack.
I was just thinking those backpacks are too heavy.
When I was a kid, I used to only wear my backpack with one, because that was the cool way to wear it, right?
But I still do.
Of course, I was walking like this. Doesn't really help, you know, supporting your back. So mechanical things like making sure our kids are wearing their backpacks on both straps. So I think it could be a number of things that could be playing a role, but good to think about, right? Because we only think about adults usually.
Absolutely.
Yeah,
but 10 is quite young.
10 is quite young. And one thing I do want to say about that too is, you know, in medicine we always say that kids are not small adults, meaning that they're not the same. So if your child is young, maybe under the age of 4, and has back pain, or has warning signs like fever or chills, or has problems walking, or gait problems, things like that, pain when they're sleeping, those are warning signs. Don't just blow that off. You need to be seen, of course, with your child. So, but yeah, the older ones, we definitely need to be looking at what they're doing.
Yeah. All right, we're going to talk about gummy vitamins.
Yes.
Becoming more popular, not just with kids. More adults are using the chewables instead of tablets and capsules. But doctors are saying that they might not be as effective. I always thought kids liked these because of the sugar element of them.
Adults too.
Yeah.
How about that?
Yeah.
I mean, I have to say that my favorite vitamins are the gummies because they taste better.
Yeah, but you had to know that
of course,
they couldn't be as effective.
Well, you know, I don't know that I can say across the board that they're not as effective. This is the thing. The FDA is not really authorized actually to review safety and efficacy with dietary supplements. That's not just the gummies, but the pills as well. There can be a number of issues with the pills or the gummies, but with the gummies, we have other issues, right? The sugary component in them, that's something. And I think we have to remember, yeah, they're not candy. And I honestly have to be very honest with you. Sometimes those gummies taste so good, you just want to eat them like candy.
Yeah. They're not gummy bears. They're
not gummy bears.
Yeah.
And of course, vitamins are not a substitute for what we should be taking in by mouth. So it's something to be thinking about. Just be cautious.
Kids' vitamins have always been tasty.
They have.
I used to pop those Flintstones like they were candies.
Because they tasted like candy.
So good.
I know many a pregnant woman that takes the gummy prenatal.
Yeah,
because they taste so much better.
Yeah.
All right. Dr. Caudle, thank you.
Always fun to talk to you.